Dr. Anna Schreiner is a licensed veterinarian in the state of Maryland. A native of Moscow, Russia, she received her associate's degree in office management from the University of Alaska, Anchorage. Her Bachelor of Science in Chemistry, summa cum laude, from Norfolk State University, and she graduated with her Doctor of Veterinary Medicine degree from the Virginia, Maryland College of Veterinary Medicine in 2012. So the year after me. And she is married, has 2 pit bulls, 2 cats, and 2 guinea pigs. Dr. Schreiner's 5 years of clinical experience is strictly in emergency medicine. She worked at 2 referral specialty and ER clinics and is currently working at a 24-hour clinic in the DC metro area, which looks planned to include specialty shortly. So welcome to the podcast, Dr. Schreiner. Thanks for spending your time to talk to me to help out, the veterinary wannabes. So I'm really fascinated. So Dr. Schreiner and I became friends when we were both students at Virginia, Maryland. And I knew that she'd come from Russia, but that school is... there was just no time to talk to her about her past. It was all study. I knew that I liked her very much. She's a very kind and considerate person, but we never really got a chance to go into our past histories together. But I've always wondered about it, and I am really excited to have the opportunity to hear about what it was like. So you grew up in Russia. So tell me a little bit about that, and if you wanted to be a veterinarian from the time you were little, and how you decided you wanted to pursue that path.
Yeah, thank you so much. I always wanted to kind of catch up and talk more with you. I grew up in a family of animal lovers, so we always had dogs and cats and a pigeon that I brought home and lizards and just like all kinds of things in the Moscow apartment. But I don't know why it never entered my mind that I wanted to be a veterinarian. It was just part of life to always have animals. Actually, my dream was to be a secretary because I always thought that they're so put together. They have it, they have their path, pretty little suits. I don't know why. That's the sad truth. I wanted to be a secretary. So growing up, I just never was something that I considered. But we always had, my dad was a huge animal lover, and we always had animals. And my dogs, I was an only child, but they were always other children of my parents, so they were held at the same, at a pedestal. Like if my dad stepped on my foot, it was like, well, you'll survive. And if he stepped on my dog's foot, it was like, oh my God, I am so sorry, my poor baby. So yeah, it was actually very natural to become a veterinarian, but at the time it was not something that I grew up thinking that I would be. In retrospect, I would say it was probably always in the cards. It just didn't form as a conscious thought at the time.
Mm-hmm, mm-hmm. And I have a similar story. It didn't occur to me until later, and I don't know why. But so you were in Moscow. You went through high school in Moscow, and then how did you make your way to the United States? How did all that happen?
That's probably a separate podcast altogether. But I'm a type 1 diabetic. So it was a people with diabetes exchange program, where Russian teenagers would come to the United States for the summer, and American teenagers would come visit for a couple of weeks in the winter. So I was part of that program, and I met my host family, who were wonderful people, and I stayed with them for 2 summers. And their church actually decided to pay my way to college. And at the time, I didn't have a clear plan of what I wanted to do with my life, but I thought that was a good opportunity to just go explore and move to a country that I didn't know anybody.
And was that in Anchorage? Was that in Alaska?
That actually came later. It was a little bit of a crazy life. That was in Kentucky.
Okay, okay,
So,
okay.
yep. So my host family were from Indiana, and the college that they picked, I didn't actually have a say on which college it would be. It was Kentucky Christian College. It's now Kentucky Christian University. So they paid my way to go to that school. So I didn't have a choice of a school. But I did have a choice of a major going into it. So that's how I ended up staying. And then I met my ex-husband, who's a good friend. And then he was military. So we ended up in Anchorage, Alaska, because I dropped out of my first school. And that's how life took me. And then I got my associate's degree. And then because of military, we moved around a lot. So Virginia was kind of the state we stayed in most of the time. So that's how I ended up being in-state student for that school. So from there.
Okay.
Kind of a very short version of a very complicated, long story.
Well, we'll have to catch up some more. Eventually, you're going to have to come out and visit me here in Flagstaff with
that.
your new husband. And then we can have some very long, in-depth conversations by the campfire with some wine. But I'm curious, just as an aside, what was your major at the Christian school in Kentucky?
I was a terrible student. I don't remember going to classes a lot. It was not a good fit for me. A Christian school was not, in retrospect, a good fit.
Right.
And it's the first time I had, freedom to just do whatever. I come from a fairly strict family, and I was on my own at 18. So I think my actual major was humanities. But I don't remember going to 8 a.m. classes. I ended up with a terrible, like a 2.4 GPA my first year in actual college. So
wow. Okay.
you guys are listening, there's hope for you too. Don't get discouraged. I paid for it yearly, but
yeah.
That was my first year in the Christian school. Yep.
Oh, that is fascinating. And that's true. A lot of people, when they go to college, that they're still very young and they want to sow their wild oats or whatever it is they're doing. But it's hard to, hit the books and not get tempted by the partying and all the social things. And I think a lot of people
a lot of parties now because it was a Christian college, but it was the first time that I got to explore a different country and make friends. And to be honest, I was never that interested in the religious aspect of it. And I think I come from a family of atheists, and going into a very Christian environment, even though I wanted to make this work, but it was I don't think it was a good fit altogether. So I think later on, when I was actually really interested in my studies, it was a much smoother transition. I was a lot more active, a lot more willing to work for it.
Understood. So then when did you decide that you wanted to be a veterinarian?
Yeah, I was actually trying to pinpoint that, and I think in Alaska, I quit a job. I was working at an optical store, and I was like, I really want to go pursue my future career, and I had my degree in office management, but I just kind of had one of those days where I was just like I left everything and became a kennel tech at the local veterinary clinic. And I loved it. Unfortunately, the veterinarians there were kind of like a very, older men club. So when I actually got nauseous in one of the surgeries, and one of the veterinarians, I asked him, I was like, did anybody in your class, do they ever get nauseous? Is this something, can I still be a veterinarian? And he just looked at me and said, no. And that no put me probably in about 2 or 3 years of not applying to vet school, not pursuing it. So I think really, I wanted to do that when we moved to Virginia and I started working at an emergency clinic, and I met different vets and they were very encouraging, and it was a different atmosphere. And that's when I knew like there was just no other choice. But yeah, it's, I wish I had the confidence I have in my 30s, in my 20s, because I would have done that sooner. But
Don't we all?
yeah, just that one comment can really send you on a on a different path.
I would really love it if you would take a picture of yourself in your doctor uniform at the ER with your stethoscope around your neck and, you know, the hospital in the background, and send that to that man.
I would love that. I don't think he would remember who I am.
Well, you should write him a letter. Shame on him. All right.
Yeah.
So then in Virginia, where did you go to get your undergraduate science prerequisites to get into Virginia, Maryland? Vet school.
So when I moved, because of that comment, I decided that no, I obviously can't be a veterinarian because, you know, one guy at that clinic said so. So I actually went to Norfolk State University because I researched dietetics programs, because I have a lot of experience in just being a diabetic. I had a lot of experience in diets and nutrition and things like that. And I was like, well, that would be probably a natural transition for me. So they didn't have it as a standalone program. They had it as part of the chemistry. So you had to pick chemistry as your major. And then part of the curriculum was you would get basically a minor in dietetics. So I did go for that. It was at Norfolk State University. They were wonderful to me, and eventually I got a full scholarship from them. They canceled the dietetics program, but I was able to stay in the chemistry degree, in the chemistry curriculum, and get it that way.
So why did they give you a full scholarship?
There was a program, and it was called the NEMIS, which is the Zorid's National Institute for Minorities in Science. It was Norfolk State University is a historically Black school. So because of how well I was doing, they asked me if I would like to participate in the program. And at the time, you know, I was doing my best. All I did was study because I had to make up for that year at Kentucky Christian College. So it was a really good fit. I definitely said yes to being in that program. And I think that really, I mean, I in my veterinary school class, I had people from Stanford and from UVA, and I was like, well, you know what, I come from Norfolk State, I'm proud of that, and I think that they were wonderful to me, and I have zero student loan debt going into that. So yeah, I stayed because even though after they closed the program, I was a little bit worried, you know, maybe I should go to like William and Mary or somewhere that would make the transition a little bit easier because of the ratings of the school. But ultimately, I'm really happy, and I've made a lot of friendships. The professors there were really nice to me, and I think that, you know, this was a good fit.
Okay. And so it was during that time that you decided that you were going to go for it and become a veterinarian?
It's kind of a weird story of how that happened. I was looking for a part-time job because my ex-husband was military. I was going to school and I was virtually not contributing to our expenses. So all I wanted was like a weekend job. So I was applying everywhere, and then actually his friend's wife told me that she has a job for me. She doesn't know where it's at, but she has an ad in the newspaper that said that they're looking for a receptionist for nights and weekends only. And it was kind of fate because I was like, well, that's perfect. And it actually didn't say that it was an emergency veterinary clinic. So I went to apply. That was before the age of internet, so it was through the newspaper. So I went to apply, and they were really happy with me. And like from day one, I was sold. Like, this was me all the way. I loved emergency. I wanted to be trained in the back, but I loved the excitement of it all. I liked the night hours. I just loved it. So that was when I definitely knew. And I was like, I just have to throw everything at it, because in every nutrition class I had, I was thinking about my job, and that I was excited to be back at my job, which was not related to any, nutrition or dietetics or anything like that. So I just had to.
That is fantastic. It's like, great, the universe was got some you.
Yeah, definitely.
Yeah, I'm not religious either, but sometimes things happen, and you just have to be like, huh, that is really interesting. Okay, so then you finished out your degree, and did you apply to any other schools, or was it just Virginia, Maryland?
I did. I applied to 4 schools: University of Minnesota, Virginia, Maryland, Illinois, and Auburn. And I got into 3 of the 4.
Good.
Yeah.
Congratulations.
Thank you. I did do an internship with Virginia, Maryland the summer before. It was, again, like an international minority internship. And I was paired with a lot of people from that school for that summer. That's actually how I met my current husband, which at the time was a 19-year-old kid who was just a friend.
How interesting. Oh my gosh.
I did an internship, and I think that really helps, because I knew a lot of people, and if nothing else, they at least saw my face by the time I was applying. And actually, one of the professors there allowed me to stay like at his and his wife's house when I did my interview. So
wow. Which
feel like
professor?
He was a professor of immunology before. I can't remember his name.
Ahmet.
No, that's virology, and I think it was I'm so sorry. I'm drawing a blank right now.
That's okay.
He worked on the IMHA project, which was my project before I applied to vet school, but I can't.
Okay.
His name. I'll have to look that up.
Yeah, I know who you're talking about, though. He's a very nice person, really kind man. Mm-hmm. Yeah, I remember him telling me that he was looking for DVMs who had PhDs in immunology. And at the time in vet school, I wasn't 100% sure which direction I was going to take after graduating. And I said, well, I am fascinated by immunology. Maybe I should get a PhD. And he said, if you do that, you can write your own ticket and go anywhere you want. I don't know if it's true. I can imagine it would be. DVM PhD in immunology, hard to come by, but I didn't. Sure. But very nice man. Mm-hmm. So, and then when you started veterinary school, tell me about first. I'd like to hear what was your idea, your vision of who you would be and what your life would be like after you became a veterinarian. First, tell me that.
I think I had a pretty good idea working in the emergency clinic of what their lives would be like. So I thought that I would be, I think I was more like a MacGyver mentality, because the vets that I worked with were a little bit like older vets that, that was before specialty was so available, even though they worked with specialty. So I kind of imagined myself like doing it all and cutting it all and, doing all of the medicine cases, because I didn't have like the grasp of just how difficult it can be and how specialty is absolutely needed in vet med. So going into vet school, I kind of had this like, I'm going to be best at like everything that I can, because when I get out, like, obviously I'm going to be the best at it. And then like with time, like now I can't even imagine like not having specialty to send them to, because it's not always, there's a kind of different levels of clients that some things that you can solve on an emergency basis, and some things like really do need, a neurology consult or a little bit further down the line.
Mm-hmm.
So I'm glad our profession is going towards that. So I think I was imagining myself being like the doctor that I worked with, because he was my kind of only example of what an emergency vet is like. So that's what I was going into. And actually, I went in having a pretty good idea that I wanted to be an emergency vet. And vet school there were a couple times I really liked our medicine rotation. I liked internal medicine. So there were a couple times where I thought maybe internal medicine would be better suited for me. But I think that I didn't realize that what I love most about internal medicine is like solving puzzles and kind of putting things together is not necessarily the major part of it. And I think kind of dealing with people and working with kind of a more high demand people and a lot more complicated cases was the majority of it, and people communication was the majority of it. And I knew I didn't really want to make that about the long-term management of conditions that can be treated. So that's how that idea kind of went away. And when I graduated, I definitely went back to emergency. And looking at my colleagues, I think that I'm kind of an exception, because I went into it wanting to do emergency, and I love what I do. Like I love emergency medicine. I think I'm well fit for it, and I think that it's just what what does it for me. So, which is not always the case. And I think a lot of people end up in emergency kind of either by default or because they don't really want to form like a lot of relationships with clients. Not that it's a bad thing, because I'm the same way. Or people who go into equine medicine or anything like that and kind of want to change and with more financial gain, which emergency provides. So there's no right or wrong reason to that. For me, it was kind of always like, this is the first time I saw emergency medicine. That's what I wanted to do. And I think that I would say I was pretty realistic about what it's going to be like when I got out. But I will say that financial aspect of it was not like even on the forefront of my brain. I thought that I will just get out, and then we'll deal with finances later. And I think if you're going into veterinary medicine, that has to be a part of the conversation. So, because the debt is pretty crippling, especially initially. So.
Right. I think a lot of people think that. Veterinary school is overwhelming, just trying to keep up with the academics. You don't have time to think about how you're going to be managing your finances later.
Yep, exactly. Yeah. So.
So tell me just give me a general overview of your experiences in veterinary school. Was it what you expected it to be, or if it was different, how was it different? Did you like it? What did you like? What did you dislike?
I didn't like it. I think it was some of the hardest times in my entire life. I love the people I met. So I absolutely love you.
Aw, I love you too.
I'm really glad that we got to meet there. And I made some lifelong friends. Like my friend Lincoln was a very close friend that still is a close friend. But I think overall, I thought it was going to be more I don't know. I thought I would be entering very like-minded people, and that it would be like a close-knit community of people that support each other. And I did not find that true. I think it was still competitive. It was still catty, but I think that if you put 80% women together and sleep deprive them and make them work extra hard, that you're going to get some of that. So
I never thought of it that way, but oh my God, you're right.
So I think none of them, I feel like I'd better understand some of the women I met in vet school now that we're both out, or not both, but not that we're all out, and we're dealing with the same challenges, but we're also living lives, and we can relate to each other better than we could in vet school. For example, there was a person that went through just a horrific personal trauma that I can't even imagine. And I remember her kind of signing up for easier cases in her fourth year rotation. entrance for orthopedic medicine. And literally everyone was judging her. She actually made it into our like class video of like, how dare she, sign up for easy cases. And at the time, I was kind of a bystander to that. But now I'm thinking like this was probably awful. Like this person went through horrible trauma, and it's okay that she didn't sign up for, like a TPLO and that she took like a suture check or something. I was like, she needed to take care of herself. And I think it's like easy to lose sight of that because it's such a isolated, different community. It's kind of removed from the real world. You're with those people day in and day out. But it's hard. Like it's hard to judge that, but it's also, I don't know, it's not a representative of a real veterinary world. It's more like a second high school in a way. So when you hear that, it's definitely true.
That's funny. Everybody that I've talked to on the podcast so far has described veterinary school as high school. Just like you. Yeah, it's funny. And some people enjoyed it and made great friends, and some people felt they didn't really fit in. So I think it varies by class too. Our class, the class of 2011, was pretty cohesive. There was some drama. There always is drama. The more people there are, the more drama there is. But on the whole, we were pretty supportive of each other.
Yeah, I mean, like no one specific stands out as like, oh, this person, like did this or that. But I think, as in general, I did not feel like I was fitting in, but I was also a little bit older, I went into vet school when I was 25, so not right after college. So it was a little bit different experience for me because I had, at the time I had my ex-husband. I had this whole life that I lived that it was difficult to go back into kind of like a closed community with a high school mentality. So,
right.
Yeah, I think it was difficult. I think some people did have a blast. I know a couple of colleagues that, especially male colleagues, that did have a blast in vet school.
Oh, the men have it made.
Yep. They really do.
Yeah. If you want to find a good wife, go to vet school.
Yeah. Any choice you want.
Right.
Yeah, I think that, and some women too, I think like I saw a couple weddings that happened, and at my wedding, I think that there were there were 3 people from vet school. And the rest were just people that I knew from before, or family members and so on, like friends from around town. But I see some weddings and it's like half of my vet school class is there. And I'm just like, I wouldn't even find that many people to invite from my vet school class. So there were like, I think there were close relationships. I think it depends largely on what kind of person you are and where you fit in. So it won't necessarily be like you'll have a blast, but I don't think that you will have a miserable time necessarily. I will say that I was going through a separation and later on through the divorce at the same time that I was in vet school. So I don't think that, that kind of skewed my experience as well. So
Sure.
It's hard to judge that, time frame based on that.
Sure. Okay. And then, so when you graduated, if you don't mind my asking, how much student loan debt did you have when you graduated?
Oh, yeah, no, I don't mind at all. I was actually one of the kind of a more lucky ones. I had 94,000 in student loan debt, largely because we had savings before I was going into vet school, and I used up all those savings to kind of, and the cost of living in Blacksburg is not that expensive. So,
yeah. How much savings did you use up?
I think I was going in with about $33,000 in savings from me working and my ex-husband being military. So we didn't actually use the money that I worked for. So this is the money that went to pay for probably about 2 years of like expenses in vet school. And then I ended up with 94,000 student loans. So if you put that together, that probably evens out to like a national average.
Right. Yes. And so you're, in a way you were lucky because you had your husband and he was working, he was bringing in an income so he could, pay the expenses, food, rent.
He took care of like the rent. I mean, we didn't live together, so and we had mortgage. So he actually took care of the mortgage because he wanted to own property in Blacksburg because he thought it was a good investment at the time. We ended up losing some of the money, I think, because when I graduated, it was 2012, and the economy just crashed. So I don't know if I would recommend necessarily buying a house if you're going into vet school, because you're going to be there only 4 years or so.
Right. And I'm really glad you brought that up, because I remember some of my classmates, they were, I don't know, they like, they picked their parents well, and because their parents bought them a house before vet school. Yeah. And I think some people go in thinking, well, it's an investment, and then hopefully the market will increase, and then when you sell, you make a little money. So, but that is an option, but not guaranteed, certainly.
Yeah.
All right. And then was it pretty easy for you to find a job right out of school?
No, it was hard because I wanted to do emergency and I did not want to do an internship because for me, I was starting life on my own. Like my ex-husband was not in the picture, and I had 2 dogs, 2 cats, and I had a chronic condition that was a medical condition. And I just could not do, a $25,000, $30,000 a year internship because there was no one kind of backing me up financially.
Right.
So I was looking for a job that would be specifically emergency and would not require an internship, which is hard to come by because the way that the way veterinary medicine is moving is towards, having internships, kind of standardizing emergency vet. And having been out for a while, I don't think that that's a wrong idea, because I do think that you get like different levels of vets in emergency medicine too, that sometimes it's scary, like some deficiencies are not something that you can correct when you've been out, you're hiring someone who's been out for 10 years or more, and they just haven't stayed current. So I do think that there's a value in internships if you specifically want to do emergency medicine. But it just wasn't an option for me. So I did end up getting a job that did not require an internship because they were very slow ER when I started. They just opened about 2 years prior, and they were in a smaller town that had another ER clinic that was established. So we only saw like 1 or 2 cases a night. So often I had nothing all night and just one case to kind of obsess over and vin it and Google it and look through all of my books and things like that. So I think that did help. I just kind of got lucky that I fell into that because I could work it up, as a new graduate with very, very slow pace. Mm-hmm. So, and then my second job actually ended up being a very busy ER, which served sort of like an internship. It's actually a place that now has interns on top of ER vets, but it was a tertiary referral facility with a very busy caseload. So I think I picked up a lot of medicine when I ended up working there. But the only reason I could get that job is because I had my first job in the ER.
Absolutely. And when you first began, what kind of mentorship did you get?
Well, it's hard to talk about my first job, which is kind of like a cautionary tale. So it ended up being a little bit of a horror story for new graduates and being really careful about what you're signing contract-wise. It was founded by 2 specialists. So every morning I had rounds with an internist and with a surgeon. So that did provide a lot of kind of feedback on what medicine I was doing. And I also had for the first, I can't remember how many months it was, but I think it was at least 3 months, maybe not, maybe a little bit less than that. But I had an emergency vet with experience that was actually shadowing me. So my base pay was much lower for those first 3 months, but at the same time, she would kind of guide friends with her. give me feedback. And she was actually an excellent mentor. We're still remain friends with her. But yep, I think mentorship is really important. So although I wasn't getting it quite as much from the specialist, but I think she was actually an excellent mentor. Yeah.
Okay. And did you have to do any surgeries, emergency surgeries?
No, actually, because it was a new ER, they preferred all the surgeries to be done by the specialist. So I actually got almost no surgical experience my first year out.
Okay.
My second job, of which was about a year after I got out of vet school, there I was required to do surgeries, and it was kind of like a little bit of a sink or swim situation. So I picked up a lot of surgical experience pretty quickly. My first job, they would allow you to scrub in and assist in surgeries, but you weren't the one performing them.
I almost think that's better. Because I started in ER as well, and I ended up having to do surgeries by myself in the middle of the night that I'd never done before. Nobody to help me, and it's traumatizing. I only worked at one ER, and I did some relief shifts at other various ERs, but I was very lucky at the ER where I worked. My contract was one page. It was like 12 bullet points, 12-point type, very straightforward, very fair, and there was no non-compete. And in my opinion, why should an ER hospital need a non-compete? The point of a non-compete in veterinary medicine is that a general practitioner doesn't build up a loyal clientele and then rip them away from the practice to go, down the street. So for a general practice, day practice, to have a non-compete in their contracts with their doctors, totally understand, right?
Mm-hmm. Yep, exactly.
Why does an ER need a non-compete?
Mm-hmm. So, yep, completely agreed. Well, it was a good learning curve, and I learned a lot about, what to look for in contracts. I think my current contract is only a few pages long. My first contract was like 17 pages long, like.
Oh! Oh my God. 7 pages? That is a red flag.
Yep, I would say that's definitely a red flag. So just be careful out there when you get the first job. But I mean, I can't complain because they did get me into the area that I wanted, and they ultimately, not by their intention, but they were kind of the stepping stone to further career in emergency medicine. So
yeah.
Once I had experience, I had the day that I decided to quit my first job, I had like 3 offers within 24 hours.
Wow.
Not like actual offers, but the interview setups and inquiries. So that was much easier. My second job was much easier. I think out of school, I had 2 offers. One was with my previous boss who I worked for as a veterinary technician, and one was with that hospital. So I ultimately ended up choosing them because it was kind of a new beginning in a new, in a new place. Then I didn't have to go back to kind of the life that I had before. So I wasn't tied to the area, and like really the main thing that I chose them is because they didn't know me as an assistant. I wanted to establish myself as a veterinarian, so I wanted it to be a a brand new experience. But the second time around when I quit that job, I had several offers. I ended up choosing the one that was closer to me geographically. So, and finally, my third ER job is the one I'm in now, and I've been there for 3 years. And that one is actually probably the best fit of the 3, but I don't think, I think I needed to have the first 2 experiences to really appreciate and be an asset to my job now.
Well, you've got a great attitude about some of the challenges. They were good learning experiences. I like that.
They really were.
In terms of contracts, just because we were talking about and trying to let people know that they really do need to be very careful about the legal end of this, I want to mention that I went for an interview at a place, and their contract had a stipulation that if you quit before the contract ended, you would have to pay them $10,000.
Oh, wow. Yep.
Yes.
No, that's a red
And
flag.
and the contract said it automatically renewed. There was a 24-hour period in between, but it was automatically renewed. So there was basically, if you quit this job, you had to pay them $10,000. Yes, and I was like, what? And, of course, the guy interviewing me was like, well, we spend a lot of resources and time mentoring, veterinarians, and then they leave and it costs us money. I'm like, okay, maybe I can kind of understand that. And then I was like, well, what if something happens, like a family member dies or gets sick and you have to move across the country to take care of them or something like that? And he said, well, then we can use our discretion. I was like, oh, really? I'm like, so what happened to the vet that left, that for whose position I'm interviewing? And the interviewer went bright red. And he told me, well, I think she had gone to veterinary school in Montana, and they had given her a state scholarship. I'm not 100% sure of the details, but it was a state scholarship. But it said that in exchange for the scholarship, she had to take the first open veterinary job in the state of Montana, or whatever state it was, right? But at the time when she graduated, there weren't any. So, which is how she ended up at this place in Illinois. And then the state job, the job opened up in Montana, and so she had to leave this job in Illinois because there was like, I don't know, $100,000 fine that she had to pay if she didn't comply with that scholarship requirement. So she left, and I said, so did you use your discretion and not make her pay $10,000? And he's like, no, she paid. Yeah.
No, that's another good point. Like, it's a huge red flag how veterinarians leave. So if you can't get in contact with those veterinarians, I would highly recommend that as well. The person at my first job I was replacing threw controlled drug keys on the floor and left, which is why I had to start 2 weeks early, because she left before 2 weeks were up. And that's a big red flag, because that means, this was very, like, it wasn't just not amicable, but there was something that, made this vet so distressed. And having worked there, I can understand where she was coming from. So things like that, they're just a little bit, my second job, I actually had a chance to speak with one of the veterinarians that worked there, and she was fairly honest, about kind of like the pros and cons. Now, it's not always that you're going to be in a position where you can, decline the job just based on the fact that some people, are not happy with one thing or the other. I kind of jumped ships into my second job without a lot of research about it. I'm still really happy that I took it. This was probably the best experience I had, like, from a being a doctor perspective. I think that my medicine has gotten much more current, much more up to date. It was really top of the line medical hospital. So I'm still glad I took it, but some of the things, that she said to me didn't actually click until way later, when I was, about to leave my job. I was like, oh, I should have listened, some of the things that she mentioned. So
yes. Can you tell us what they were? When I was entering that clinic, the general sense was kind of unhappiness because they were changing contracts that people had. Half of the veterinarians at that place kept changing. It was kind of a little bit of a revolving door for vets. So she was kind of voicing some of the concerns, like, that things that I remember them actually saying, we're optimistic for the future, but right now we're just really tired of, the constant changes that are getting thrown at us, and the contract changes and things like that. And at the time, it didn't make enough impression on me that I didn't take the job, so I still took it. But it did come into play later on, where I was like, oh, I understand what she was talking about. So was it like they were changing things, like asking you to work more hours than you'd originally agreed to, or If you can, if you can give details, I like to offer the audience some really granular information. So,
Sure.
if you can, but if you can't for legal reasons or whatever, I understand.
So, and like I said, I still would have taken the job, and I think it made me a good veterinarian. But one thing was management complaints, and there's a lot of management complaints. Like, this is almost every clinic that you'll ever apply to will have some issue with management. Whether it's a huge issue or just like they don't listen to us a lot, or a small issue, but they're kind of the people that end up on like the other side of of the fence when people are unhappy with their working conditions. But in that case, management just wasn't willing to make small changes. Like, the contract had some weird parts to it. Like, for example, you had to give up your personal time to go to events, like promoting events. So you would give up like 8 hours, the whole day and things like that. And if you didn't, there was actually a penalty in your contract for your percent production. So I don't know if it was there when I started. At some point that was canceled. So, but I initially, it was a big deal because, for example, I lived about an hour away. So for me, it was giving up my entire weekend day, which I've worked every other weekend. So you end up giving up, your precious weekend to do something that you don't get paid for, really, and then you get penalized if you don't do that. So things like that, like this, it wasn't like each one of those individually were small things, but put together, they kind of did put people over the edge because the clinic was extremely busy. So it was very common for us not to get out, like 2-3 hours past our shift. There was a very busy tertiary ER. So on top of that, when you do kind of like those small chipping away at personal time and require things like that, it does start to make a big difference, and people definitely feel it. And I think, I'm not a manager and I've never been in the position of managing ER vets. But I do think that, making their life comfortable and like making clear boundaries of, this is work and this is not work. And when you're off work, you're not required to come in. You're not required to do all those extra things. I think that's important. So that's another thing I would read for in your contract or ask, what are the outside of kind of performing doctor duties requirements. So there were a lot of things like another thing I had at my second job was I had a project area. So and then you were evaluated quarterly on what progress you made on that project area. Like my project area was isolation room. It was very vague because I didn't have like a specific project on that. It was just, so I'm not even sure what I was evaluated on because I'm like, well, we have procedures, we have, things are already in place for that room. So I guess like we can repaint the walls. I don't know what I'm actually being evaluated on about that room. So like some people had, like a donor program, like a blood donor program as their area. But some people had like strange things like a radiology room, which is like literally a tiny room with radiographs are taken. So it's hard to, and if you get quarterly evaluated on that room, there's only so much improvement you can make to the room. So so I was a little bit confused about that. There was a lot of things that like chipped into your personal time.
Right, because they didn't allow extra time for you. It's not like they said, oh, okay, we'll take you off of the floor of the hospital, 5 hours every 2 weeks. And during that time is when you work on your ISO project.
Exactly. And you were supposed to work on that sometimes when it's slow in the hospital. But the problem is it was a really busy tertiary ER hospital. So even if you had a couple of hours, you wanted to read VIN on a case that you had, or you wanted to, or even do nothing, just like eat lunch in peace. So there was really like no realistic time where you would have a huge amount of downtime to work on your project area. So things like that. I mean, those were things in the contract at my second place. So it was kind of like people felt devalued. Veterinarians felt devalued, like they were there in. they weren't, like honestly, in every vet clinic, veterinarians is what brings the money, and and they were just kind of treated as like interchangeable,
Commodities.
yeah. And they were some of the best doctors that I've ever met. So it was hard to see that they weren't treated like they deserved.
Was this a corporate practice by any chance?
I believe it is now. It was board owned at the time that I worked there.
Okay. So it wasn't corporate when you were there?
It was not. No.
Okay. Because I know a couple of my colleagues who work in ER have had similar experiences, and both with corporate ER hospitals. So that's why I ask.
Yeah, I think that's common. It basically now I think it's run more like corporate, and they have different facilities. It wasn't at the time though, but I mean, there's pluses and minuses with everything, with corporate and with board owned. I know veterinarians, like some really good vets that will just not, they just will not work for someone who's a board owned anymore after that experience. So that's true.
Okay. Okay.
It's also hard, like board owned, to work for a combination of clinics with primary veterinarians that sometimes have never worked in the emergency setting. So, it's a, they are bread and butter and they're great people themselves, but I don't think that they always understand.
Clarify when you
like the nature of emergency medicine.
That is an excellent point. So I just want to clarify, when you say board owned, what you're talking about is a group of local day practice veterinarians got together because they didn't want to have to be on call all night long every night, right? And they decided to start an ER hospital, and they are the people on the board of that hospital.
Exactly.
That's what you're talking about.
That's correct.
Yeah. That's really interesting. I'd never thought about that. They're day practice vets and they're making all the rules for you ER guys, and they don't really know. They may not have ever worked in ER. That's a really good point.
Exactly. And I think that's common, like knowing from other, knowing from other ER clinics that I know of that I haven't worked at, it's kind of a similar problem. You run into your boss not being the one able to relate to your day-to-day, practice. My boss now is an ER vet who works kind of side by side. So it's not a perfect clinic, but she understands what we go through. She understands what it's like to have a hell weekend where you just see cases nonstop and there's no time to, give a full update to a primary vet and be on the phone for 20 minutes when you just literally don't even have 2 minutes to yourself. So
right.
Things like that.
Right. Did you have a medical director at the second ER hospital?
We did. She was a criticalist. She's still a criticalist there.
Was she on the board?
She was not. So she was actually hired by the board to manage us, which presented some other problems too, because, I would say the board is who she answered to. So, as you can imagine, sometimes that can present a conflict.
Yes. Interesting. So the ER where I worked, they also had a board. It was just as we were describing, but the medical director of the hospital was on the board. And so I felt like that made a big, and he was an ER vet. He was an ER vet and he was on the board.
That makes a huge difference.
It made a huge difference because, for the most part, it was a very fair place and for the doctors. Yeah. Okay.
Yeah.
Okay. So it sounds like this was like the most intense period in terms of your medical experience and learning, right?
Yeah.
Tell me about that.
I came in with because the clinic I was leaving, they bought the other clinic in town, so they actually just got busy as I was leaving them. So I did get used to kind of a high caseload, very busy pace right before I transitioned, but I don't think that I was fully prepared for the depth of cases that a tertiary hospital would get. So we would get things that basically ERs already, they went through several ERs, sometimes through several primary vets, and what they really needed was specialty and ICU, and it was really fast-paced, very difficult cases, I would say. Like, it wasn't straightforward like a first-time heart failure. It would be like a third-time heart failure with, pulmonary hypertension and all kinds of other things, or like pancreatitis and cancer and diabetes all rolled into one, and so things like that. Not that we don't get those cases here, but there by far was the most challenging. Like, I've seen things that I probably will not see again unless I work in another tertiary hospital. So it was very intense, and I would say like not the medical director who was the criticalist, but other fellow ER doctors. Those were probably the closest friendships that I formed. I actually just celebrated my birthday and one of them leaving the other day. But those were like the closest professional and personal friendships that I formed, because we were kind of all in it. And that's who you had to run your case by and kind of get some support and get some opinion. So I learned as much from them as just from the difficulty of the cases, but they kind of had they had suggestions, they had what works for them, or they've seen a case like that, or, some of them were like just brilliant people that would be like, oh, in 2006, there was an article that described this and this. So it was a very high level of medicine, very fast paced, but the doctors were amazing, and they were really, really, it was a very close knit group of people too. So I don't remember any interpersonal conflicts between the doctors, because
Nice.
they were, we were all so stressed in a kind of a tiny room all together, working nonstop. So it was actually like I said, I trust those people with my life, very close-knit group of friends.
And were you working overnights at this place?
I was hired to work on overnight, a swing, and a day shift. So it would go from like a day to swing to overnight. So it was a gradual. I ended up working days several times, and then we ended up being a doctor short. So I did work a lot of overnights as well. So I don't remember my schedule exactly by the time I was leaving, but I did work a few overnights. For a while, my schedule was just days, but it was only a couple of months. Usually it was swings and overnights. And then when I quit, I actually worked there as a relief doctor. So those shifts were mostly swings, because it was just easier for me to pick up a swing shift. So with a swing shift, you don't get the hospitalized patients from before. You kind of just collect everything that comes in, and then you round it to your overnight doctor. So that was a better setup. I think that if I could like work in my ideal emergency clinic, I would just work swings.
Right.
They start too early, they don't end too late. They're like the perfect time. So
yeah.
That's not always possible.
So just to give a little extra explanation. So a day doctor at an ER is typically, 7 a.m. to 7 p.m. And then the night doctor is going to be 7 p.m. to 7 a.m. And those doctors are responsible for the hospitalized patients, plus outpatients, so people bringing their pets into the ER through the front door, right? Mm-hmm. But when there's a swing shift doctor, they're usually like, 11 to 11, right?
Like 12 to 12, 2 to 2.
Right, yeah.
The place was so busy that now they have 2 or 3 swing doctors.
Okay.
Because of how busy it is.
Okay. And that is the advantage of the swing. It was the same at my hospital. Just outpatients. You didn't have to worry about the critical patients in your ICU and see your outpatients as well, right?
Yep, so that's my
yeah. And when you were working overnights at this hospital, or any of the shifts that were you ever the only doctor in the hospital? And how did that feel? And was especially because of the complex cases that you were seeing?
Yeah, so you were, and my shifts were mostly primary shifts, meaning it was either morning doctor or overnight doctor, which would be you would be responsible for all of your hospitalized patients. So the latest swing that we had when I worked there left at 2 a.m. Not they didn't necessarily leave at 2 a.m., but that's how long they were seeing cases. And my shift was over at 7. So for 5 hours between 2 and 7, you were on your own. And it can be very challenging in the busy ER because if you have a lot of unstable patients and you have constantly patients coming in, you just cannot catch up, so to speak.
Yeah.
So you're trying to, do your best with kind of like internally triaging, what's the most pressing problem, who's the most unstable, can this, like a lameness in the that's coming in the exam room, can they wait an hour before you stabilize something that's actively trying to die on you. So that can be very challenging. It helps when you have people there, like if you're on the primary shift and you have swings, because then you can be like, I need you to take all of the incoming cases because I really need to stabilize those 3 patients. Like I cannot leave them. So that helps. Sometimes overnight it can be pretty rough. It's also rough if you have a surgery. And at my second clinic, you did cut you on surgeries. So like if you have a bloat, you're off the floor for an hour and a half. So not only you're coming back out to patients that need your attention, that are hospitalized, but you may also be coming back to patients that are waiting to be seen. So
Yes.
it can be pretty chaotic. So I work best when it's stressful, though. I just realized that I need a little bit of drama in my life, and it's best when it's like work, my personal life. So I do enjoy when it's busy, and I think I get the best focus when everything kind of gets thrown at me. Then I get to kind of sort it very well. When I have like a lot of time and a lot of things, I feel like I end up procrastinating about things. But when it's everything all at once, I get very good at sorting things out. So it certainly works. And sometimes you just have to have, I would say my other advice would be like really good communication between your clients and between your techs. When I know it's going to be, an hour of wait, sometimes I will tell them, because all clients see is an empty, waiting room. So they think that you're sitting in the back and you're drinking tea and, watching TV and waiting for your show to end, when in fact you're like trying to, actively save something that's trying to die.
Yes.
Or you're in a procedure and blocking a cat, but they don't know that. So sometimes you need to send a technician or your front desk and just tell them, the doctor's in the procedure, it's an emergency, so it will be a little bit of a wait. So it's a small thing, and I think communication is underrated in vet school as well, because you're just coming out thinking you're going to be, this rock star medically, or you'll do your best job medically. But the medical aspect is actually probably about 50%, if not less, of being a good doctor in general. And the other 50 is just being really good with people and with communication. So I think best advice is no surprises for anyone. So I try to keep the clients in the loop. I try to keep my techs in the loop about what I'm doing. So like, I will see this one and this one first. This one can wait, and then we'll do this procedure, so that they kind of know what's gonna happen.
That's right. That's right. And while I'm in the room, I need you to draw blood on this one and do a CBC chem, right? Yeah. Yeah. That is excellent advice, especially in an ER, because there's no set schedule, and it's all up to you to drive everything. And so the surgeries that you were doing, were you doing them for the first time by yourself, or did you have anybody to call for help?
I was doing that by myself, and like I said, usually I had swing doctors that would step in and just kind of, sometimes I needed them to look at it and tell me, does this look pretty, like, is this too bruised? So they would step in and give me their opinion, but they were seeing their own cases, so it's not like they couldn't scrub in with me for the entire surgery.
Right.
So it was a lot of like preparation, and a lot of the times I just had like one of the doctors kind of walk me through what they do. So it's I learned best by hearing, so I just needed to hear kind of what they do. And I would say I had one surgery out of all the ones that I've done so far. And I don't count the ones where you come in and you euthanize on the table. That did not go well. It did initially, but then it's a patient that had several RNAs, which is when you cut the intestine and you cut out a piece of it and then you suture it back together. So you cut out the diseased or perforated aspect. So that patient did end up I'm sorry, actually it was an enterotomy patient, but there were two enterotomies where you cut out the foreign body from the part of the intestine. So that patient dehisced, meaning the incision fell apart. And it's not necessarily that it's your fault, but I definitely, I kind of lost sleep over that. Yeah. But the next time I went to a conference, I went to every single surgery lecture, and I just kind of was like, I'm going to at least know everything that I can know. Now do different, and I did like minor adjustments. Like I changed my suture size. Now I use a 4-aught PDS, which is kind of a much smaller suture than I was using before. Minor adjustments and things like that. But I definitely lost sleep over that, and I was new, so I was like, is this me? Is this the dog? And to be honest, it could very well be just the dog. They don't always, sometimes things dehisce. I did my best job. I checked everything. Nothing was leaking from the incisions or anything like that. But that dog ended up going into a second surgery. The dog lived and did fine, but it had to have a revision surgery several days later. But I don't know. I think that the one part of the personality that you should have is like, don't continuously tear yourself down because of something that went wrong. Like it's okay to go and get more experience. It's okay to kind of see like what could have been done better, but just kind of, step aside for a little bit and just look at it non-emotionally, And then I would say a couple months later, I got a dog with like exactly the same, like it ate exactly the same foreign body. I don't remember what it was like a cloth something. It had to have exact 2 enterotomies, and that dog did great. So but yep, I remember my first bloat, and I remember this person putting so much faith in me because it was a tertiary referral clinic, and I was like, I don't want to tell you that this is the first time I'm touching a bloat.
It's crazy, isn't it?
Yep.
It's crazy. I mean, you think about like human surgeons, right?
Yes.
When they're doing a residency, I swear for the first 3 years, the only thing they do is suture up the skin.
Yeah.
Or hold the instruments. Right.
The same thing. I think we had a student recently, and she asked me, how much surgical experience I had in vet school, and I just had to laugh. And I was like, honestly, I couldn't even close anything. Like other than a spay, like the interns get to close, but you as a student, you don't even get to close anything. Yeah. So that all comes after, and it's it was definitely steep. And I will say I graduated being completely terrified of surgery. Like I thought that I would be, best suited in a hospital that doesn't do surgeries. ER vets don't do surgeries, and it's just, like a surgeon or something. So actually my first clinic was a fine fit because they didn't ask me to do surgery, and I was like straight up terrified of it. And the more I did it outside of vet school, and I think vet school kind of gave me that sense of doom that, if somebody touches the corner of my drape, the whole field is unsterile, everyone's going to die, it's complete mayhem. And then in reality, it's not to say that I haven't made mistakes, but I've done so many surgeries now that I feel pretty confident about it. And I actually do end up liking surgery. But I definitely didn't graduate with that feeling. And I think, had I stayed in emergency only that wouldn't let you do surgery, I think that I would still be terrified of it. So I was kind of glad that I was kind of thrown into it and just made to do surgeries because I love them now. So surgeries are fun to me. So.
Yeah, I love surgery too, but I share your terror. And even if there's just another doctor in the hospital that can peek in,
Exactly.
That's helpful. But it's funny that you say that about when we were in vet school and how terrified they made us. I don't know what, because you're not the first person to say this who graduated from our program. I interviewed, I don't know if you ever knew her, Dr. Shelley Spangler. She was
Yep.
medical director at Angels of Assisi.
Yeah.
But I interviewed, you've met her?
Yep, I did an internship at Angels of Assisi.
You did, and wasn't that incredibly helpful? The spays and the neuters that you did.
So much.
Yeah.
Yep.
Yeah. But she said the same thing. Like when she graduated, she was terrified of surgery because of her experiences in the surgical labs at the vet school, where the techs were yelling at you, just if you stood in the wrong place, or you accidentally touched XYZ. It was like, oh my God, the sky is falling.
Yeah, I agree.
You're out of here. You fail vet school, and it just, I remember feeling so stressed under those circumstances that I was in the locker room getting dressed and ready to go into the lab. And I felt so much stress that I said to myself, you could just put your regular clothes back on, walk to the parking lot, get in your car, drive away, and never come back. Like they just made it so much more stressful than I think they should have. I mean, I'm sure they were doing the best they could, and they wanted to impress upon us the importance of adhering to these principles of asepsis and all that. But they scared the crap out of us, and it was not helpful.
No, I feel like it was like that there was like the right way, and that right way had like very, very narrow margins. And if you weren't doing it exactly that way, or if you forgot like one step, or something happened in the way, that it's like the end of all. Like you killed a dog, you just like, you might as well just quit now. And it's most of the time I would say it's not the case. Like mistakes that you will make in surgery usually are something that you can rectify. So I'm not saying like you got into something you shouldn't, but like if it's, I remember going to Angels of Assisi and I was doing a spay, and there was a cutaneous bleeder, which means that there was a blood vessel that bled a lot from the skin. And I was just panicking about this, this cat is going to bleed out, it is, I don't know what to do. Should we transfuse her now? Like it was just a complete breakdown.
Awesome.
And I think that the other veterinarian that was there, she was just like, well, just put hemostat on it and then we'll just recheck it after we're done. And I was like, really, this can work? Like we're not at the death sentence stage. And it wasn't. And most of the time, like I tried to be like, we have a lot of students, and some of them are vet students, while others are like high school students or anything like that. And I tried to make it not seem like this life and death, and and certainly some things are, but things that like you should do, you should tap a chest or pericardium, things like that. But when you make a mistake, if you don't make it sound like this is the end of the world, then people don't get this like freeze feeling. Like then you just kind of have to figure out, what is your next step? Like if you made a mistake, what is your next step? And then if you did make a mistake, like, you opened the belly and found the mass that you didn't count on or anything like that. Just kind of like thinking through it is very helpful. And I feel like in vet school, it was just the end of like, you didn't circle answer A. So the whole thing, you might as well just give up and call it quits. There wasn't a lot of like, now what? And I feel like I wish that was more in vet school. Like,
oh, amen.
Yeah.
Yeah, actually, in the book that so the series that I'm writing about being a veterinarian, the second book is on going through vet school, and I use that exact phrase. Now what?
Yeah.
Yeah. But I think that's a really good point. Just remaining calm and thinking your way through it. Yeah. And keeping everybody else around you calm.
Mm-hmm. And
As
you have
well.
to have it in the ER. It's when you start panicking, and then you get your technicians are really frustrated. So, and I mean, honestly, you'll make more mistakes by panicking, and then you will make the entire staff unhappy because you're the boss on the floor. So when they sense you being, unhappy and frazzled, then it changes the whole tone of the day. So,
It's very true. It's very true. Yeah. I think that was my biggest challenge when I first started as an ER vet is because it was frustrating. It was scary. It was a busy ER. I was a brand new veterinarian. I had to look everything up. I was flustered. I was scared. I was terrified. I was frustrated. And I think it was hard on the technicians that I worked with until I learned to calm the hell down.
I agree, and I mean, I think as a technician too, they don't. I don't think that they can relate to the level of stress you have as a vet.
No, no.
Being a technician, when I was a technician, I would try to diagnose things when they walked in, and a lot of times I would be right, but I wouldn't, think of the times that I wasn't right, or when it was like a lot more difficult than I would assess. So I think they have a lot of knowledge, and they're very helpful, and they're wonderful. But I don't think like the stress of being solely responsible for the
Yeah.
entire shift and for all the animals in the hospital and for everything that lives or dies, whether or not it's your fault.
Absolutely.
Much more than you can feel as a technician.
Yes. Yes. It's very true. It's very true. And I don't think you can even imagine how it feels to be in that position until you get there.
Yeah.
Yeah.
I agree.
But I would say try your best to act calm, even if you're freaking the hell out.
Definitely fake it.
Fake it. You have to fake it.
And fake being calm.
Yeah. All right. Well, and then so you seem like you're very happy now at your third ER position. It's the perfect fit for you. And you've transitioned to days, haven't you?
I have just recently, but that
That's great.
wasn't a decision made on because of the workload. There was a decision made because of the health issues. So, like I said, I'm a type 1 diabetic, and it was just really hard to adjust from 1 week, living on night schedule, and then turning around and living a whole week on a day schedule. So, so for that reason, like I still love overnights, but I do feel, and this might be a little discriminatory, but I do feel like ER is a little bit of a young people game. So as you get older, it becomes a little bit harder to do overnights as your primary, as your only schedule.
Yeah. Absolutely. Yeah. So, but congratulations on, getting your day shifts. Cause I think, to me, that sounds like the perfect veterinary job is to work ER during the day.
Yep.
Yeah.
No, it's fantastic. I mean, it comes with its own, like, I worry a little bit more about production because I do work on a production-based schedule. So it's definitely slower than, my overnights have been. During the week. So like Wednesday and Thursday overnight, I can be just crazy busy. But Wednesday day might actually be pretty slow.
Right.
So I did lose, like it was a decision based on health and based on like more time with my husband and things like that. But it is, I definitely took money into consideration because it is less money working days if you're working production.
Okay. Yeah, that's a good point. Did you have the choice of going salary versus base plus production?
No, my current job, we're all base pay plus production.
Okay.
So, and it's not a guaranteed base, meaning that if you don't make a certain amount of money, then you would owe it to the clinic.
Oh, hell.
Yep.
Oh.
Yeah. Fortunately, I've never been in a position that I didn't make production or made a bonus. I've made bonus every single month, so it hasn't been an issue. But going to days, it's a little bit more on the front of my mind than, it was on overnights. But on overnights, it was always busy, so I knew we would always make production. So days is kind of there will be a drop, and I know that that's coming. But that was, it was a decision also based on the fact that I paid off student loans, so it was time to
That's the other thing I want to congratulate you about. Dr. Schreiner, 5 years. Now, granted, you have half the student loan that I graduated with, but you still had about $100,000 in student loans when you got out of school, and you paid it off in 5 years.
Yeah,
so that's amazing. And congratulations. And tell me and tell the people who are listening, how did you do it?
Well, it's an answer that not everybody likes because I took a hard look at it, and I knew that I didn't want any debt going forward. And for me, the secret was I did not use income-based repayment plans or anything like that. I made it, I think I might have for a couple of months, and then I changed it back. So my loan, I think, was either 10 or 15-year loan, whichever one is the shortest one. I think it was a 10-year one. So I had the really skyrocket high payments. I had a $1,000, $970. So $1,000 payments every month that were due on that repayment plan. So the way that my work is, I have a base pay, and then I have production, and I would get production bonuses. It was monthly that I would get them. So I put every single production bonus into my student loans.
So about how much was that every month?
So I would say it depending on the month, but in summer months it could be anywhere from $4,000 to $6,000.
Wow. Wow.
Yeah, it was a really busy year, so I would put that, but I also did relief throughout the first, actually the last couple of years. I did not make any progress on the first year out because I was paid basically bare minimum to live at my first clinic, the one that was fashion retail. So I haven't taken any progress with my loans the first year out. So majority of it came from the last 4 years. But I would put every single bonus that I had into it, which we're on percent production. So, and it was busy, but I worked overnights. So overnights will get you a lot higher bonus. And then I also did relief. And relief, I would say if you're doing ER relief, you can get paid, $70 to $100 an hour. So it ends up being a nice relief check as well. So I really honestly didn't want anything else more than I wanted to pay off my student loans. So I still drive 2005 Sinex A, which is a crappy little car with 160,000 miles on it. I could get a new car now, but because my husband has a car through his work, I just drive his car, and I decided we'll pay off our mortgage instead. So I did not get a new car. I did not live, outlandishly beyond my means. So I'm not a saint, so I do online shop and, and buy things that I shouldn't. But
you take some very nice vacations. I loved all the pictures of when you were in Japan.
Well, now I'm actually really lucky because my husband has a job now and he works, in the area. So our expenses are shared. Can I stop you for 1 second? I see my phone battery is getting low. Can I?
Oh, sure. I'll just pause it. And here we go. Okay. Battery problem fixed. So we were talking about you're paying off your student loans in 4 years, because the first year you couldn't really do it. But and you were putting what, $5,000-$6,000 a month towards your student loan?
So I think when I did the math, each year I was putting total of 22,000.
Okay.
For the last 4 years, where only it would have been 12,000 if I was just paying what they say. So about twice of what was required.
Yeah. Yeah, that sounds about right. And it's interesting because you had about half the student loan I had, so I have 200,000, and my 10-year payoff plan is like $2,200 a month.
Oh,
So it
wow.
makes sense that yours
Yeah.
is 1,000 a month. So,
Yeah.
but that, you know, like doing 2,000 a month and being able to pay into principal, you know, a lot quicker. Um,
I think that's the key. The principle is what kills you, because like if you don't take care of that, the interest accumulates, and then you're kind of always behind.
yeah.
I think my first payment, it all went into interest, because that's when I kind of panicked and decided to pay it off, because my first like $800 payment, I looked at where it was applied, and it was all applied to interest. So it
Yeah.
didn't even matter. Like my principal didn't even budge. So
Yes, yes, I had the same experience, and I went on IBR um, when I was like in between jobs and not sure what was going to happen. I went on IBR, and I was paying I was paying 1,000 a month, and I looked at my statements, and 100% of it was going through interest. That's all it was for.
yeah. Yeah.
Yeah.
Well, I'm really, I don't, I mean, I'm not a financial consultant or anything like that, but I'm kind of really against IBR plans because of that, because I feel like they kind of trap you into that loop.
I would
Um,
agree.
yeah.
It's just too tempting. It's just too easy to pay less than you need to. Um, I mean, it gives you great flexibility. Like, you know, what I'm doing, I'm not working right now. I'm trying something else, podcasting, blogging, writing books, and see, you know, what happens. But so my IBR payment is 0. But that's not good. That's not good for like the future.
Yeah.
So I am hoping to get to the point where I can start doing what you did, and you know, do more than you should be paying more than what they're
Yeah.
asking you to pay every month if you want to make any progress at all.
Yeah,
But
definitely. And I will say that's not for everyone, because in my situation, you know, I knew I didn't want kids. That never entered my life, where a lot of people have kids like out of school, and that definitely adds to the expenses. So, but like I said, I drive the same old car. We live in a townhouse. We did not buy like a, you know, $500, $6,000 mansion. So I wouldn't say like, yes, we do go on a lot of vacations, but I think it's also like how you prioritize money a little bit too.
mhm.
Like for me, the travel was really important. Like that was my luxury. So I would rather not have like a brand name clothes or bags or anything like that. I'd rather go to a different country. So that's a priority. Like that's my luxury spending. It goes on travel. And I also like try to find a deal, or, you know, kind of work it out long term. So, but it was also, you know, like even with vacations, it would be like one extra bonus payment, because if you're going to like anywhere in the Caribbean from the East Coast, it's actually not that expensive, and things like that. So it is a little bit about prioritizing and, you know, what's important to you, because I do have classmates and, you know, some of the vets I know that like move into an expensive area of DC. You know, they want to live like in the center of it all. They want a nice brand new car because they just graduated and they're doctors now, so it's time to go buy a nice car. And I understand that, you know, like this is not a judgment call. I understand that like intuitively that's the things that I would also like, you know, definitely. But at the same time, you know, if you have a huge student loans, that's not like you're putting yourself in a hole that you can't get out of. Then you have mortgage payments that are much higher than, you know, if you commuted to work. You have just, you know, it adds up. So I think just being smart about it. But I think mostly I also like I worked overnights, which is the majority of money being made in the ER. I worked weekends, and then I did a lot of relief.
Mm.
So I would say in the last 4 years before I paid them off, I probably did, I would say, at least like 3 or 4 shifts a month extra. So not a lot of relief, but, you know, a lot if you count that I had a full-time job. too. So that helped a lot. And like, I knew it was a finite and I knew I was working towards a goal. So that helped, because it is an easy way to burn yourself out as well. But I like literally, I watched my balance drop and drop, and that gave me like the most satisfaction.
I bet.
So yeah.
Yeah. And did you, during this time, did you like have a written budget for yourself?
You know, I tried that. I tried to have a budget, and I don't think that it worked well for me. So I just kind of did on like what I normally spend money on. So I had to just curb some of those habits, but like sticking strictly to a budget just doesn't always work for me. I think we kind of need to go back to that. I had an idea of a budget, so it wasn't like exact numbers, even though I did do exact numbers, but it was kind of like, you know, this month we ate out like a lot more often than we normally do, or like, hey, let's be careful with money because like we just spend this much on this, you know, aspect. Or like we bought my husband's car in 2015, so it was like, well, we just bought that car, so you know we have to hold off on vacation or something like that. So it's kind of like a mental check-in point. I'm lucky because I'm married to someone who is also like, he's conscious about money, so I think that helps too, and that's not always the case. So
Yeah. And he's an engineer, right?
He's a geologist.
Geologist. Okay.
Mm-hmm. But
Okay.
he works with engineers and things like that.
Okay. Okay. Does he make good money? I don't know what geologists make.
Not as of yet. I mean, he makes a decent money, but it's about half to 1/3 of what I make.
Well, go you. Now, did he have student loan debt as well?
Not. He had like his family saved up money for him to go to college, so he used up that money. So he actually did not have any student loans.
Wow, that's great. You guys are in great shape financially. Then I'm so happy for you.
Part of what we did towards it, and part of it definitely luck. So not everybody's in that position for sure.
Yeah, but I think it's important for them to hear for future veterinarians to hear your story, because it definitely gives them an idea that it is possible. And if I had been as disciplined as you, I might be, I don't know, a little more than halfway to paying off my loan by now,
Well,
So,
when your husband gets, is he still in residency now, or he actually?
No, he finished residency. He's working, but he's got, hold on to your seat. He's got $400,000.
Oh, wow.
In student loan debt. So, yeah. And I don't care like what he says or what he does or anything like that. I'm not asking him to pay my student loan. He's got his own student loan to pay off. And, huh?
That's nice of you. It makes sense, though. Yeah, I feel the same way.
Yeah, and I don't know. I've never been the type that could, I don't know, go for like I'm not a gold digger. But I didn't marry him for the money. I married him because he's smart, and we both understand medicine, and that's exciting. But the gift that he can give me is to give me some breathing room while I try to do something different and see if it works. But I'm not going to make him pay my student loan. That would be, oh gosh, if I wanted that, I should have married like some old 78-year-old millionaire. And poke him in the morning. Still alive?
I always said that, and I married someone 5 years younger, so I'm doing it wrong.
Right. Stephen is 5 years younger than you?
Yeah. Mm-hmm.
Okay. Yeah, Alex is 8 years younger than me, so we're both cougars.
Yep.
Well, let me ask you this, Dr. Schreiner. You've been very generous with your time so far. We're going on almost two hours, so I don't want to take much more of your time. But tell me about, are there any mistakes that you can think of that you would like to warn other people to avoid? You already mentioned about, getting a lawyer for contracts. And so if we've already answered that question, the next question I would ask you is, what advice would you have for future veterinarians?
That's a good question. I really think, and I think I already touched on it a little bit, but it would be communication. I would say if you can get your communication to, like, don't assume people know what you're talking about, and don't assume that, that it will all work out somehow, because it won't. It's things that you will miss and will let them go home and, steaming, or you don't talk to them. Like, those are the things that will come back. I think that my biggest thing was, and sometimes you'll have unreasonable clients, but initial response was with unreasonable clients and, with very highly emotional, to like internalize it and take it very personally, and especially in ER. And then I feel like, it would do me good to learn kind of early on that it's really not about me. Like, what they're steaming and mad about is either, they're in a highly emotional situation where they're looking for someone to blame, and it just happens to be you because you're the deliverer of bad news. So don't kind of internalize it. And I see vets going on, is there something I could have done differently? I'm a terrible vet, and of course, like, I missed this, I missed that, because ultimately you will make mistakes. I've made mistakes. My colleagues make mistakes. A lot of people make mistakes. You will not be as good of a vet, I feel like, if you don't make mistakes and learn from them. Because everything that the mistakes that I've made is what, those are the most memorable cases for me. Like, those are the things I remember for sure. I'm like, I know what's been done, and I know what could have been done better. So don't beat yourself up, and just keep lines of communication open between you and between the owners. Sometimes it helps to kind of figure out what is the common goal, because your goal with your clients is the same, is to help their animal, but it helps if you're on the same page. And as far as vet school goes, I think it ends, and I think that's the best part about it. It will make you a vet. But I don't think vet school defines you as a veterinarian. So, I was a straight B student. Like, I had a couple of C's, I have a couple of A's. I had a 3.0 GPA in vet school. It did not budge, despite of how hard I tried. That was my entire being, but it didn't actually matter what kind of vet I became. So I do feel like I'm proud. I'm proud to be a vet. I love my job. I do love being an emergency vet, and I feel like I really had a chance to show it in clinics and then further in being a vet. So doesn't, if you didn't get that every single nerve in that limb right in on that anatomy test, it means nothing for what kind of vet you will be. So I don't I feel like I spend so much time beating myself up, unnecessarily for things that I missed, or, I didn't get it quite right, or how can I do surgery if I don't know every single nerve that supplies, hind limb of the dog. And you can, and you will, and you will forget half the stuff that you learned, and you will still be a good vet.
That is great advice. Thank you. Thank you for that. And as a former ER vet myself, I really appreciate it. So the last question I have for you, Dr. Schreiner, is what are your future plans? I know you said you wanted to pay your mortgage off, but give me something more exciting than that.
Yeah. I just turned 35 yesterday. This is the excitement now.
35? Yep. 35. That's still so young.
Oh, I felt old. But I don't know. I don't have career-wise, I would like to stay in the ER medicine field. I really don't think of anything else that's more fitted. Sometimes I'm thinking about, venturing out into industry or anything like that, but it's usually when I have a bad day or anything. So I think I'd love to stay in ER medicine and hopefully continue to work days. My clinic is adding specialty, so I think we're only going to get busier. So I'm happy where I am right now, or, if this clinic for some reason doesn't work out, a similar setting I think would be great. Personally, I don't know, my husband and I are looking for kind of like a bigger house with a bigger yard because we have two pit bulls and a tiny yard. So, so that kind of like goes into financial and personal goals. But I don't know. I was just saying, like, literally yesterday, actually my birthday was Tuesday, so 2 days ago, that I really don't know of anything that, that's left on my list of things to do in life. Like, I feel like I've achieved like everything that I wanted. I know this is not going to be probably something that a lot of people can relate to, and it sounds maybe conceited, but I'm honestly like happy where I am right now. So I'm just planning on enjoying that.
Well, I would hope that people would be happy for you and not, envious and think that you're conceited. I think that's wonderful. I think that's what we should all strive for, and so you don't have to have a really expensive flashy car or super nice house in order to feel like, hey, I've got everything I want. And the point is to feel like you've got everything you want, right? And you feel that way. So that is the true definition of success.
That's true.
I think that's wonderful. And I think I wished you a happy birthday on your birthday. Didn't I?
I think, yeah.
I did. Okay. I just want to make sure people don't think I'm being rude. Happy birthday belated. But you also, the last thing I want to ask you, sorry, there's so many things that we haven't talked in so long, but one of the things that you do that I think, I mean, you tell me I'm being presumptuous perhaps, but it seems to be something that helps you manage stress, and it's something that gives you fulfillment, and that is your artistic pursuits.
Yeah, I draw and I do collages, and for a while I think that was something that I wanted to maybe like make a second, like a side business too or something like that. But then I realized then I'll be taking it away from myself as like a stress relief because then I'm putting it on a timeline and on a commercial base basically.
Right.
I think that that's important. I think that the reason that I'm happy at my job, and especially now, and I will say my job is not like a lot of other jobs. I do only have 10 shifts a month of VR, which is low load for most.
That is amazing. This is like two and a half days a week is basically what you work, right? Did I do math right? Yeah.
I work 5 days, 1 week, and then I have 7 days off.
Oh, that is so great. That's just fantastic.
And it still counts as a full time because I think it ends up being about like 36 to 40 hours. And it can be long, like, during summer days and all that. And it might not work long term because, our clinic is bought part by I wouldn't say that they're corporate, but they do have several clinics in the network. So I think the pressure is starting to be a little bit more on like making money and cutting the cost down. So we may eventually go to even 12 shifts a month if that happens. So, which wouldn't be the worst thing in the world. But right now I'm definitely enjoying the schedule I have. So I think that the reason this works so well and why I'm like really happy is because I have a really good balance between professional and personal life. So just when it's like all gets a little too much, I have like a week off where I just literally not expected to do anything vet med related. So yeah.
Yeah. And in your week off, you're not just vegging out on the couch, you're doing things that make you happy.
I am.
Sometimes you are.
Because I take my dogs to the park too. I play Pokemon Go. I catch up on like laundry and things like that. So, which is where the whole idea of like a second kind of side business came in. But then I realized I actually really enjoy just like not being responsible for anything for a week. So I feel a little guilty because my husband doesn't get the same benefits from his job. So I try to cook dinner and be more present in my family life during that week off. But I really do think that that's a huge part why I really enjoy vet med is because there's clear boundaries and I do get a lot of time off.
With emergency, as an emergency vet.
Yeah.
Yeah.
Mm-hmm.
Yeah. I don't think the GPs could say the same, unfortunately.
No, no, and I think that that's where there a lot of burnout comes from, is because our hours can be completely insane. So
Yeah. And when you're working your 5 days, I mean, but those are long days. Those are 12-hour shifts, right?
yeah, they're usually 12 hours, but they often go to like 14 or so.
Oh, 14, 15, yeah, because you got to stay after and finish your records. So yeah, I just 12-hour shift. That's when you're officially accepting patients. And then you do your records, just to clarify for listeners. But when you're on those 5 days, that's, I don't feel sorry for Steven, because he's got probably a 9 to 5 job, right? And
He doesn't. I feel bad because he works with a construction crew. And in the summer they do have like 12-hour days. In the winter they have like 9 to 5, but in the summer they're trying to get everything done. So
okay. I thought it was like a desk job. But does he take care of you when you come home from your 12-hour shifts? Does he make the dinner and?
Yeah, he does, and I feel like I'm very lucky with my marriage too. He really is, like he doesn't care that like construction guys tell him like, oh, it's a little girly to cook or something. He's there. He will make dinner. Like he will take care of our animals. He will clean. So I'm very lucky. I'm just a very lucky person in life. So I'm sorry, guys.
No. You chose well. You've made good decisions. It's not just luck. There's some luck, but you've also made good decisions, and you chose a good life partner. So I'm very happy for you. Very happy for you, and happy birthday again.
Thank you.
And thank you again for all of your time. And I think that future veterinarians listening to all of the advice that you've given are going to benefit greatly for it. So on behalf of them, I thank you.
Thank you for asking me to be part of this.